We're now going to talk about some micronutrients and ultratrace nutrients that are also present in calcified structures in Chapter 10. Trace element concentrations in human enamel and dentin. There are very small amounts of several minerals that are considered essential for the optimal growth and development. The upper intake levels haven't really been established for a lot of these nutrients because there's a lack of data, but evidence suggests that ultratrace minerals may be physiologically essential. We're going to talk about copper first. It is the third largest trace element found in the human body, following iron and zinc. Its functions are in the formation of red blood cells as well as our connective tissue. It is a catalyst in the formation of collagen, which all of these things are important for the structure that support our teeth. It is a component of many enzymes and functions in oxidative reactions. And copper-containing enzymes can encourage the production of our neurotransmitters such as norepinephrine and dopamine in the brain. Some food sources are organ meats, seafood, nuts and seeds, whole grains, wheat bran, as well as cocoa products. Its absorption is enhanced by a low pH, and the absorption can be affected by large amounts of calcium and zinc, which can decrease its absorption. Hyperstates of copper is seldom encountered, but we do see this occasionally in patients with rheumatoid arthritis, patients that have had a myocardial infarction, possibly conditions requiring estrogen, as well as pregnancy. Wilson's disease is a metabolic disorder that is associated with a high state of copper. And what happens is large amounts of copper will build up in the liver, kidney, brain, as well as the cornea of the eye in these patients. This causes what they call a Kaiser-Fleischer ring, which is a brown or green ring around the patient's eye. If copper is taken orally, 10 milligrams or more can actually be emetic, meaning it can make you either nauseous or induce vomiting. Here are some images of what I was talking about with the Wilson's disease and that Kaiser-Fleischer ring. In Wilson's disease, we'll see central nervous system disorders, hepatomegaly, which is an enlarged liver, arthritis. We'll see copper accumulating in tissues, maybe renal tubular dysfunction of the kidney, cardiomyopathy of the heart, and then again, the effects on the eye. Low states of copper can occur if we have a patient that's taking zinc supplementation. Zinc can affect the absorption of copper. So individuals also on TPN, or total parenteral nutrition, which is IV nutrition, sometimes will exhibit low states of copper. And symptoms in these patients would be decreased hair or skin pigmentation. They might have a low white blood cell count, abnormal formation of collagen and elastin, which could result in a failure for children to grow, maybe spontaneous fractures or osteoporosis of the bones, arthritis, bone deformities, those kinds of things. We're going to talk a minute about selenium. It is a cofactor for antioxidant enzymes and helps protect membrane lipids, proteins, nucleic acids from oxidation. It also has an impact on skeletal integrity and can contribute to the maintenance of our immune system. It works alongside with vitamin E as an antioxidant, and they have seen that selenium is present in tooth enamel as well as dentin, and is probably incorporated into that enamel during the amelogenesis process. Recommended daily is 55 micrograms for adults and 400 microgram per day for adult would be the upper limit. Some of the sources for selenium are animal products such as seafood, liver, kidney, and other meats. We can also find selenium in dairy products and eggs, which is more readily absorbed than the selenium from other foods. Whole grain products such as nuts, mushrooms are also good sources. High states or hyper states of selenium could lead to cirrhosis of the liver. And it also, high states can promote dental caries if that's given pre-eruptively, before the teeth have erupted. Symptoms of hyper states of selenium might be nausea and vomiting, weakness, dermatitis, hair loss, white blotchy nails, and a garlicky breath odor. Low states of selenium have been linked to cardiomyopathy, which is also called Keeshan's disease, which is typically not seen in the United States. Some of the physiological roles of chromium. Chromium has been involved in carbohydrate and lipid metabolism, and it's believed to potentiate the action of insulin. So they have actually done studies on chromium and its link to insulin resistance or diabetic patients, since it potentiates that action of insulin. But there's limited evidence to support the use of chromium supplements for glycemic control in those individuals with type 2 diabetes. But there is some thought that it could be helpful. It is odorless and tasteless. An adequate intake of chromium per day is 20 to 35 micrograms for adults. Average chromium content in a well-balanced diet is 13.4 micrograms per 1,000 calories. It is poorly absorbed, and typically our chromium status decreases as we age. Sources for chromium are meat, whole grain cereals, wheat germ, nuts, mushrooms. Hyperstates of chromium can be caused by supplementation, overtaking chromium supplements, liver damage, and lung cancer. Hypo states can be caused by a decreased insulin sensitivity, glucose intolerance, an increased risk of diabetes, and patients that are on TPN, total parenteral nutrition. Some of the physiological roles of manganese are prevention of osteoporosis, insulin production, amino acid, cholesterol, and carbohydrate metabolism. Manganese is absorbed in the liver and excreted in bile. And absorption of iron is inversely proportional to the absorption of manganese. So if there's high amounts of manganese, the absorption of iron is going to decrease. Sources are, as listed, whole grain cereals, legumes, nuts, tea, leafy greens, and infant formula. Manganese in a hyper state can be an environmental contaminant. So elevated concentrations in salivary plaque and enamel are associated with an increase in dental caries. And some of the symptoms of a hyperstate of manganese would be ataxia, headache, fatigue, anxiety. We used to see this in men that worked down in the mines. I guess there was a large amount of manganese in the environment in those settings, and they called this manganese madness. The syndrome had symptoms very similar to Parkinson's disease. So again, they had that ataxia where they kind of wobble when they walk, and headache, fatigue, anxiety. So that was known as manganese madness. Manganese deficiencies have never been reported in anyone that eats a normal diet. If someone were on a strange or altered diet in some way, you could see abnormal formation of bone and cartilage, growth restriction, maybe congenital malformations, impaired glucose tolerance, poor reproductive performance. Molybdenum is another micronutrient. It functions as an enzyme cofactor and could inhibit caries formation. Sources for molybdenum are legumes, whole grain, cereals, nuts. Low states of molybdenum, except for deficiency reported during TPN, we haven't seen a deficiency in this nutrient in the United States. Some ultratrace elements. There are some studies that suggest relationships between some of these ultratrace elements and the development of caries in humans as well as animals. Boron, they think may have an effect on the metabolism of calcium, phosphorus, manganese, or vitamin D, and may be needed in order for humans to maintain membrane structure. Some of the sources of boron would include foods of plant origin, and if you were deficient, it could affect our ability to metabolize minerals. Nickel, as you know, is the element that we see a really high allergic response to, especially in women. It can have a pronounced effect on, you can see the gingivitis around the braces of the patient on the image A, and that is because the devices that are placed in their mouth contain nickel. We see persistent perioral or labial eczema on an orthodontic patient. Again, this is their body's reaction to the nickel. And some foods that might be high in nickel are seen on this chart here. Sprouts, beans, nuts, seeds, mussels, chocolate, licorice. So nickel's physiological role is unclear, but they think it might be involved in vitamin B12 metabolism. Silicone's physiological role in structure and resilience of collagen, elastin, and polysaccharides. Sources for silicone are whole grains or root vegetables like potatoes, onions, and tin. You hear us talk about stannous fluoride all the time. Stannous fluoride can be very helpful for sensitive patients. It can be helpful for the teeth in a lot of ways. But stannous is another word for tin, and it also causes stain, which is the one drawback to using stannous fluoride. Tin, again, like I said, is stannous. It plays a role, they think, in the utilization of calcium and zinc and can affect bone growth and maintenance. Aluminum, probably not an essential nutrient. Its presence in the body actually appears to be harmful. Many people thought that aluminum was associated with Alzheimer's patients. They thought that aluminum would accumulate in the bone, and it has been observed to cause osteodystrophy, may reduce caries. Accumulation can occur through oral ingestion of, again, aluminum hydroxide antacids. So a lot of people will take Tums because they contain calcium, and they'll just take them to get their calcium, but they're also getting a high amount of aluminum by doing that. So if you have a patient that is using Tums for the calcium, it would be beneficial to get them off of that and onto just a calcium supplement of some sort that doesn't contain all the aluminum. Aluminum is also found in a lot of the deodorants, and like I said, it was linked to an increased risk, they thought, in Alzheimer's disease. I don't know that that's been proven or scientifically based. Breast cancer, prostate cancer in men. So those are things that you might hear people mention when talking about aluminum. There is no known role in human nutrition for lead. It is an environmental contaminant that can impair intellectual development. A large proportion of absorbed lead into a human system can be incorporated into their bone and their teeth. It can cause pitted enamel. Inorganic lead can have detrimental effects on children. Paint used to contain lead, and babies will stand on the side of their cribs and chew on the wood of their crib, and many babies they think were contaminated with lead by doing that. A lot of older homes, if you go to strip paints off of woodwork or things like that, you need to be aware if it contains lead, because you want to use some sort of you want to cover your face so that you're not breathing in or inhaling any of that lead, because it will become incorporated into the skeleton or teeth. And on this chart, you can see on number 2, it says most children get lead poisoning from lead paint in homes built before 1978. It is important to find and fix lead in your home as soon as possible. Have your home inspected by a lead inspector. Don't remodel or renovate until your home has been inspected for lead. Home repairs like sanding or scraping paint can make dangerous lead dust. So it's very important to use proper like a respirator or some sort of mask to avoid inhaling those dusts. Lithium is another ultratrace element that can accumulate in bone and decrease our calcium content. Vanadium, if you're deficient, it can consistently impair any biological function in animals they've seen. Sources are shellfish, mushroom, parsley can contain small amounts as well. Mercury is not a nutrient, and it is often found in fish and in the water supply. Trace amounts can cause neurologic as well as developmental problems in babies and young children. So the FDA and the EPA recommend potentially vulnerable consumers limit their intake of albacore tuna to less than 6 ounces per day. Pregnant women are one of the consumers that they recommend this to. As the baby's developing, we don't want mercury in mom's system because that could lead to developmental problems. So it's important to watch your albacore tuna intake. And at the back of your chapter, there is a article on Alzheimer's disease, which is pretty good. I would recommend you read that. There are a lot of patients suffering from Alzheimer's disease at different varying levels. This disease was actually identified over 100 years ago, and 60 to 80% of the dementia cases in America are actually Alzheimer's disease, which it affects 5.3 million Americans. It is the 6th leading cause of death in our country. The incidence of this disease increases as we age, so 65 or older, and every 67 seconds someone develops Alzheimer's disease. It is not a normal part of aging. Those younger than 65 could also develop this disease. It is typically slowly progressive. These patients have a deterioration of judgment, orientation, memory, their personality can change, and their intellectual capability decreases. It usually is about 8 to 10 years between onset and death. And in this image, it shows you how Alzheimer's affects the brain. In the top image, there's a picture of a healthy neuron and dendrites and axon. And then in the lower part, you can see the diseased neuron and how the amyloid plaque wraps around the different proteins and breaks things up, and the actual white matter and gray matter of the brain changes in an Alzheimer's patient. There's a severe shrinkage of the hippocampus, their ventricles in their brain enlarge, and there's cortical shrinkage also visualized. So it's a horrible disease, and we are seeing it more and more, and we have a lot of patients, I think, that have been affected with this. Some of the risk factors for Alzheimer's disease are age, a family history of this disease, head trauma they think could could possibly be a cause, and then again the genetic disposition, and there is no treatment available to delay or stop the disease. There are some medications that they've used for memory. I think it's called Aricept. So there, you'll see some things that they're using to kind of treat some of the symptoms of the disease, but there is no treatment to stop or delay this disease, unfortunately, at this time. For Alzheimer prevention, staying physically active and brain healthy diet, low fat, low cholesterol, and antioxidants, remaining socially active. My grandmother had this, and she tended to do the very same thing every single day of her life and never really challenged herself or did anything different. And the doctors always recommended, you know, getting her out, getting her to do different things on a daily basis. The problem with that is if a patient actually develops Alzheimer's and they have not done these things prior to, now they're going to be fearful of those things because they don't do well with a change to their environment. Routine is good for Alzheimer's patients. Many times it's hard to get them out of their home or their natural living environment because that's what they're used to. Other things make them scared and fearful. So these are things that you would want to do prior to an Alzheimer diagnosis to prevent that possibility in the future. Some of the warning signs that a patient might have Alzheimer's disease would be memory loss that's actually disrupting their daily life. They're having challenges in planning or solving problems. They have difficulty when performing a familiar task. Maybe they're confused with the time or where they are. Trouble understanding visual images or spatial relationships. They have new problems with words and speaking and writing. They misplace things, and then they have an inability to retrace their steps. They have a decreased judgment or poor judgment. Maybe they're withdrawing from work or social activities that they normally would have enjoyed. And you start to see changes in their mood or their personality.